Now joining us is Dr. Lesley Foster, Masimanyane Women Rights International founder. Dr. Foster, thank you so much for joining us this afternoon on Newsfeed PM. Let's just start with how disturbing these numbers are. As much as it's not a new phenomenon that we have to face right now, but it's still shocking when you just think about girls as young as 10 years old being impregnated, and in all intents and purposes, these are rapes.
Absolutely. This is statutory rape. And what we are not focusing on is the perpetrators of these rapes. We don't hear about arrests that are being made. We put the shame and the blame on the girls. All of the focus is on the young girls. Well, there has to be focus on these children because it's not teenage pregnancies, it is child pregnancies. And the fact that they are lacking sexual education on sexual and reproductive health and rights is a very, very important aspect of why girls fall pregnant. We, in the work that we do as Masimanyane Women's Rights International, find that girls do not know about their bodies. They're not aware of how sexual and reproductive health and rights affects them. They are not taught about menstruation. So we see menstrual illiteracy, menstrual poverty being serious issues for girls, and especially very young girls. At 10, 11, 12, those are children, and they shouldn't be, falling pregnant. What we're not acknowledging is that in the Eastern Cape, there is the practice of ukutwala, where girls are forced into child marriages, and through those child marriages, they suffer violence because it is repeated rape that they experience, and then they fall pregnant, and then they have these babies. It also contributes to the high levels of both child and maternal mortalities, the death of young women, as a result of pregnancies. So I think we are failing young children. We are failing our society as a whole because we make and allow the vulnerability and the risk for these girls to be increased, through many different factors. One is the lack of access to information, the lack of understanding of their bodies around sexual and reproductive health and rights, the lack of parental support in many, many communities. The parents are out working, or there's just one parent, and that's normally a mom, and no present father. So there are many societal factors, societal determinants that lead to these pregnancies, and we are not addressing it in a comprehensive manner. We have our National Strategic Plan on Gender-Based Violence, which deals with this issue. People are still not aware of that plan sufficiently enough to put it in place. I think government, certainly the MEC, has spoken about, her shock and horror. It has to go beyond that. It has to go beyond, just responding to a report that's coming out. We need a consistent, comprehensive prevention program run in all schools. The fact that schools are now looking at having school nurses is going to help, but the educational process, including this into the curricula of schools, is important. Sex and sexual education is still a taboo in many communities, and that's a big problem because children don't get to learn about what can sex lead to, that it actually leads to a pregnancy. Some of the children that we've had, very young children, have talked about being attacked by a snake at night. That's the only language, the only concept that they can relate to, as to what's happening to them, which shows the lack of education and understanding of what's happening. Recently, also, we've come across the phenomena where parents, as a result of poverty, one, are forcing their children into early marriage, and two, are actually prostituting their children out because it's a way to put food on the table. So we cannot disassociate teenage pregnancies from inequality and poverty. Those are the structural drivers of the problem that we have now. Because the more education, the more exposure, the more children have their needs fulfilled, their basic needs to decent housing, to food, to education and so forth, the less at risk they will be of falling pregnant at such young ages. Also, the inequality refers to how women are seen in our society, and women and girls. So girls bear the brunt of household chores, and they are often meant to, sent to fetch water where there isn't any water, or they're meant to, expected to fetch wood. And in those excursions, they are abducted and raped. But I think in the Eastern Cape, why you're looking at such high numbers is because of the problem of ukutwala. And we haven't heard that mentioned at all in this discussion on teenage pregnancies. I think we need to have open and frank discussions. We need to engage parents in the prevention of pregnancies, and we need to be having dialogues with them. We run in intersectional and intergenerational dialogues, which I think are very, very important, because you get younger people talking to older, people about the challenges that they face. And then, of course, lack of access to reproductive technologies, family planning, and so forth. That's a very, very big challenge as well. But let's comprehensively deal with inequality in our society, the negative norms, attitudes, and behaviors towards women and girls, and then also poverty, and hold men responsible. We don't talk about accountability. There is no accountability in the whole question around teenage pregnancies. I've never heard of the arrest, of a boy that has impregnated a girl or anything like that. We need to talk about accountability, but accountability has to be at state level. It has to be at the level of institutions like the Commission on Gender Equality and Human Rights, and then it has to be societal, within the family and the community. And those are the key issues that lead to, a high rate of child and teenage pregnancies.
And that's a question I had for you, Dr. Foster, to say, do you see that correlation between, when we're looking at that age group between 10 and 14, those are statutory rapes, and there's 94 of those girls there. Do we then see 94 cases of statutory rape being reported at the SAPS? And if we don't see that, then shouldn't we then be tracking that process as well to ensure that there is accountability?
Absolutely. That's the big question, is where are the males that are responsible for these child pregnancies? Now, I think what is happening is that there's so much fear and anxiety around the actual teenage pregnancy, that families are not aware of the fact that they can report these rapes. Or the girls are not giving the names forward because they've been threatened with murder, with, or any kind of hurt and so forth to them. So actually, when these child pregnancies are discovered, it's too late in the term for, in terms of the pregnancy to actually do anything about it at that point. But they should then be asking who are the perpetrators of these acts of violence, because it is a horrendous act of violence, and then to call them to account. So SAPs need to be involved. The Department of Education at schools, there should be an avenue for the girls to be able to report what has happened to them and who has been the perpetrator of that violence. A lot of the time, the violence is within families anyway. And when it is the practice of ukutwala, there has been a financial arrangement put in place where, the person who has identified a girl that they want to marry as such, but really it's I don't know if one could actually call them that, but they are then pay a price for those abduction of the girls, and then they rape them into submission, and then the girls are pregnant and they're completely powerless. So the act of completely depriving these girls of any kind of power that they may have is one of the heinous parts of all of this, that we're talking about. So families have a big responsibility in this. Where children are left alone, that is a big problem as well. And in many families, children are raising themselves because their parents are absent. They may have long working hours. They may not even be present. And I know, quite a few children where they left at home with an auntie and the parents work in another city. It could be Cape Town or Johannesburg or something like that. So in the case like that, those children are learning or being raised by their peers and not themselves, and it's always negative influences that they are exposed to. But the issue of who is raping these girls and why, you see, if we're not holding perpetrators to account, it'll just continue. It'll
Yeah.
just continue to spiral out of control. The other aspect of this that we don't discuss is the infection of HIV.
Yeah.
I mean, these
and that
young
is a
girls
very
are
big
prone
factor,
to that.
Dr. Foster, and unfortunately we've run out of time. I would like to get you back on the show to talk more about this because it's a very important discussion to be had as well. But thank you so much for joining us and your insights there. That's Dr. Lesley Ann Foster, just talking about those alarming teenage pregnancy rates coming out of the Eastern Cape.